So now let's move on to look at specific entities within the GI tract according to the mnemonic vitamin C. I think a logical way to look at the GI tract would be to divide it into upper GI tract and lower GI tract. So for upper GI tract here, in this instance, I'm following the endoscopic definition, which is oral cavity all the way to the duodenum. So the V in vitamin stands for vascular, and in the upper GI tract, we can have esophageal varices. This is often seen in association with cirrhosis of the liver, and you will learn about liver next. So in cirrhosis, what happens is that there is usually portal hypertension, and there is opening of the submucosal venous plexuses within the esophageal wall, and these can be prone to bleeding. So a very potentially serious clinical consequence is upper GI bleeding, and this may manifest as hematemesis, so vomiting blood. Now, in the lower GI tract, there is ischemic colitis or ischemic bowel. One of the very common causes of this would be atherosclerosis involving the mesenteric vessels, and also sometimes in conditions of systemic reduced perfusion or hypoperfusion where there's low BP, that can also be resulting ischemia. A very common condition, which I'm sure you heard of, is hemorrhoids or piles. This is again where there is dilatation of the venous vessels within the anal canal, which can be prone to bleeding. So, of course, symptom-wise, in the lower GI, there will be lower GI bleeding. So usually there'll be blood mixed with the stools. Now for the I, this stands for inflammatory or infectious. A very important condition in the stomach would be peptic ulcer disease. Of course, this also affects the duodenum. And one of the most important and the main commonest etiologic factor is actually HP or H. pylori infection. This is a bacteria, and it can also be caused by drugs, also iatrogenic causes such as NSAIDs. Now, in addition to peptic ulcer disease, one can also have chronic gastritis, and chronic gastritis can also be caused by H. pylori infection. In fact, it's one of the commonest causes as well, and there may be associated intestinal metaplasia. Autoimmune gastritis is also an important cause of chronic gastritis, and this is where there is antibodies to the gastric parietal cells as well as intrinsic factor. Now, for acute gastritis, often this may be due to drugs, again, such as NSAIDs, sometimes steroids as well, corticosteroids, and it can also be caused by alcohol consumption. And this can lead to bleeding, quite generalized bleeding and oozing in the gastric mucosa, which can present as upper GI bleeding. So these patients may present with black tarry stools, which is characteristic of melena and upper GI bleeding. And peptic ulcer disease itself has got several consequences. Bleeding, of course, is one of them. But in addition to bleeding, there can also be perforation. The ulcer can actually go through the entire wall of the stomach, leading to peritonitis. And there can also be obstruction when the ulcer heals. For example, if the ulcer is in the pyloric canal, when there's healing by fibrosis, the whole pyloric outlet becomes very narrowed, and therefore this can lead to gastric outlet obstruction. Now, looking at inflammatory conditions in the lower GI tract, there is enterocolitis. This, of course, can be due to a whole host of different types of organisms, viral, bacterial, parasitic, such as amoeba as well. And inflammatory bowel disease is a big category by itself. The two main entities, one of which is Crohn's disease, C-R-O-H-N, Crohn's disease. This, one of the important complications because of very severe fissuring deep ulcers as well as fibrosis would be fistula formation as well as strictures. So it can actually result in obstruction as well and infection due to fistula. Now, the other big category is ulcerative colitis. Ulcerative colitis usually affects more the larger bowel and distal large bowel, and it gives rise to continuous ulcers. Whereas in Crohn's disease, usually you have more the terminal ileal involvement with skip lesions, so normal mucosa in between. Ulcerative colitis is important also because after long-standing inflammation and regeneration Sometimes the mucosa can undergo dysplastic change, which is, if you recall, pre-malignant, or it can potentially then transform into adenocarcinoma. So these patients need to be on regular follow-up surveillance. And of course, another very important entity would be acute appendicitis, which I'm sure you've heard of. This would usually present with periumbilical pain moving on to the right iliac fossa, and you can read up about why you have this particular pattern of pain. And then a very important complication is perforation. So perforation can give rise to, again, peritonitis and potentially sepsis. Now, the next category, the T, stands for trauma, and I also include here mechanical causes. One of these is GERD, gastroesophageal reflux disease. So, gastroesophageal reflux disease can predispose the mucosa to intestinal metaplasia. So first there's columnar metaplasia. So the normal squamous mucosa of the distal esophagus becomes columnar, and then there is intestinal metaplasia. This is known as Barrett's esophagitis, and the danger of this is that over time there can be dysplasia developing, and then finally even adenocarcinoma. So the carcinoma downstream of Barrett's esophagus is actually adenocarcinoma rather than squamous cell carcinoma. Now, another condition that is mechanical in nature, affecting the stomach, would be pyloric stenosis. So we mentioned earlier that it can be one of the sequelae or complications of peptic ulcer disease if it's in the pyloric channel and if it heals with fibrosis. There can, of course, also be perforation, and an example of a cause would be actually iatrogenic due to OGD, which is esophageal gastroduodenal scope. So essentially a scope. Now, in the large bowel, there is a whole series of conditions such as volvulus, when the bowel twists against itself, intussusception, where a little bit of the bowel wall actually protrudes into the adjacent bowel lumen, and then adhesions, usually due to previous surgery in intra-abdominal surgery. So all these can give rise to obstruction, and when there is obstruction, there is a dilatation of the proximal part of the bowel wall, just proximal to the area of obstruction. And sometimes there is also a component of ischemia, especially in conditions like volvulus, where there is a thin constriction at the point of twisting, and therefore the venous return gets blocked and the bowel can actually undergo hemorrhagic infarction. So all this will predispose the bowel wall to perforation, and again, this will ultimately lead to peritonitis and sepsis. Diverticular disease is another mechanical condition, and you can read up a little bit more about how it occurs. And for diverticular disease, usually the clinical presentations would include bleeding, lower GI bleeding, as well as inflammation. So there can be pain and sometimes also perforation at the site of the diverticulum. Now moving on to the A, which stands for autoimmune conditions. I just want to touch briefly on pernicious anemia in the stomach. There is what we call autoimmune gastritis. So for autoimmune gastritis, there are actually antibodies to the gastric parietal cells, and these are the ones that are responsible for secreting acid. So the patients often end up with hypochlorhydria or achlorhydria, and it can also, these antibodies are also against intrinsic factor. So this will of course affect the absorption of vitamin B12 and therefore result in megaloblastic anemia. Now, in the stomach, in autoimmune gastritis, usually we would see a lot of atrophy of the gastric glands and sometimes intestinal metaplasia as well. So here we've covered VITA, Vita, and the next section will talk about the last few letters of this mnemonic.